Thank you for joining us for this Flinders University Brave event, Courageous Questions. I'm Karen Ashford and I'm delighted to be your host here this evening as we explore key questions about non-Indigenous leadership in Aboriginal and Torres Strait Islander health. We've chosen for this event to coincide with National Reconciliation Week in the spirit of this year's theme, Reconciliation Takes Action. Importantly, I'd like to acknowledge that this event is taking place on the traditional lands of the Kaurna people and that we pay our respects to their elders past, present and emerging. We acknowledge their continued connection to country and the important cultural beliefs, systems and undertakings that they can share with all of us here and in the future. We'd also like to convey our appreciation to the elders of all of the nations upon which Flinders teaches and reaches. Tonight's event is delivered as part of our Brave lecture series. Why Brave? Well, through Brave, we showcase our researchers who challenge the status quo and bravely investigate with a view to resolve some of the grand societal challenges of our time. This series is supported by our valued presenting partner, Bank SA. Tonight's forum is being live streamed, so if you're unable to stay for the whole presentation, you can catch up later on online at flinders.edu.au. As always, we're keen to make this an interactive event with a Q&A session. It's your chance to participate in the conversation and take part in the discussion in real time. We do ask, however, that everybody treats this forum as a place of respect where differing views are treated with understanding, with tolerance and with dignity. So these are uncomfortable subjects sometimes that we tackle, hence the name Brave, but we do ask that everybody has a degree of consideration in their interactions as part of this forum this evening. Now, if you're online, we're ready to start receiving your questions. You can either message on the platform on which you're watching, or you can join the conversation on Twitter using the hashtag #BraveResearch. Tonight, we're fortunate to be hearing from Flinders University Senior Research Fellow, Dr. Annabelle Wilson. Dr. Wilson is an advanced accredited practicing dietitian with extensive experience in Aboriginal and Torres Strait Islander health research. Her PhD was awarded in 2012, entitled Addressing Uncomfortable Issues, the Role of White Health Professionals in Aboriginal Health. She has worked with Aboriginal people both as a dietitian and a researcher in urban, rural and remote communities across Australia and has a strong commitment to working in partnership with Aboriginal and Torres Strait Islander people and to ethical research and practice. She holds current funding for multiple Aboriginal health research projects, including the NHMRC-funded project Aboriginal and Torres Strait Islander Health Workers and Liaison Officers' Role in Quality Acute Healthcare Services. It's a mouthful, but I got there, Annabelle. She leads research related to communities of practice as a tool to support non-Aboriginal health professionals working in Aboriginal health, Aboriginal football players' understandings of wellbeing, understandings of wellbeing in the SANFL, and more recently, attitudes and behaviours of South Australians towards COVID-19 testing. So a really broad reach of research. Dr. Wilson holds a number of leadership positions, including the current Scientific and Social Program Chair of the 2022 Dietitians Australia Conference. She's regularly invited to speak and work with primarily non-Aboriginal organisations about working in Aboriginal and Torres Strait Islander health, based on her research with Dietitians Australia and the collaboration of obesity prevention sites, amongst others. So it is my very great pleasure to invite Dr. Annabelle Wilson to present tonight's event, Courageous Questions, Transforming Non-Indigenous Leadership in Aboriginal and Torres Strait Islander Health. Thank you, Annabelle.
Thank you, Karen. I would like to begin my presentation tonight by acknowledging the Kaurna peoples as the traditional owners of the lands that we are meeting on, as well as pay my respects to elders past, present and emerging, and acknowledge the traditional owners of the lands across the Flinders footprint. I would also like to acknowledge Aboriginal and Torres Strait Islander peoples and colleagues in the room and on the live stream. It is important that I highlight that what I will be presenting tonight is work that I do in partnership with others. I do not work in isolation. Much research and many conversations and experiences with both Aboriginal and non-Aboriginal peoples have contributed to the ideas and work that I will present tonight. And I thank those people for spending time with me and trusting me to share their experiences and honest opinions, which often come from a place of vulnerability. It's currently National Reconciliation Week, and the theme this year is More Than a Word, Reconciliation Takes Action. This theme invites us all to move beyond listening, reflecting, and talking to asking hard questions in taking action towards reconciliation. It is my great privilege to be invited to speak as part of the Brave lecture series at Flinders University during Reconciliation Week. Reconciliation Week reminds us of the need for non-Indigenous people living in Australia and Aboriginal and Torres Strait Islander peoples to move forward together. The 2020 Australian Reconciliation Barometer told us that support for reconciliation in Australia is growing and that more Australians want to get involved. Most Australian people now believe that it is important for Aboriginal and Torres Strait Islander histories and cultures to be taught in schools, and we have seen proposed changes in the Australian curriculum recently that reflect stronger teachings on this issue. Support for a treaty and sovereignty has grown, and there has been improvement in Aboriginal and Torres Strait Islander peoples feeling that they can be true to their cultures in different settings. However, despite this, there are still huge gaps in movement towards true reconciliation. The 2020 Barometer showed that 52% of Aboriginal and Torres Strait Islander peoples have experienced at least one form of racial discrimination in the past 6 months, up from 43% in 2018. In addition to this, there is a lack of trust between Aboriginal and Torres Strait Islander peoples and non-Indigenous peoples in Australia in both directions. Just 44% of Aboriginal and Torres Strait Islander people have high trust in people in the general community, with only 30% of the general community having high trust in Aboriginal and Torres Strait Islander people. Despite government efforts to close the gap in life expectancy and many other health conditions, Aboriginal and Torres Strait Islander health status has not improved. These statistics are unacceptable and they must change. Statistics reflect our society, and differences such as these show us the huge amount of work that must be done to remove racism, improve equity, and build trust across all aspects of our work and social lives. Tonight, I will present my view on how, through transforming non-Indigenous leadership and asking courageous questions, that all of us can move beyond just talking about reconciliation and instead take action and responsibility. The role and importance of Aboriginal and Torres Strait Islander leadership is well established. However, the role of non-Indigenous leadership and how it can be enacted in a way that does not compete with Aboriginal and Torres Strait Islander leadership must be considered. In my presentation, I will use Aboriginal and Torres Strait Islander interchangeably to refer to Aboriginal and Torres Strait Islander peoples as the first peoples of this country. I will use non-Indigenous to refer to all peoples who identify as being non-Aboriginal and non-Torres Strait Islander. My key message tonight is that non-Indigenous leadership in Aboriginal and Torres Strait Islander health, both in the workplace and in community and social settings, requires a fundamental shift. To do this, both individually and collectively, non-Indigenous peoples must: 1. Have the courage to shift the focus away from Aboriginal and Torres Strait Islander peoples and towards themselves, also known as shifting the lens. 2. Recognise, value and incorporate Aboriginal and Torres Strait Islander knowledges and perspectives. And 3. Use a strengths-based approach. In addition to this, non-Indigenous leaders must grapple with the elephant in the room. That is, concepts of power, colonisation, white privilege, white fragility, and systemic racism. And in doing so, they must be willing to ask courageous questions and therefore be vulnerable. These are the points that I will lead you through tonight. First, shifting the lens. Shifting the lens is the process by which the focus is moved from someone else to yourself. Tonight, I'm talking about shifting the lens from Aboriginal and Torres Strait Islander peoples to yourself. Research from my PhD with allied health professionals showed 4 types of people working in Aboriginal health. Those who felt they didn't know how to work in the area, those that were too scared, those that thought it was too hard, and barrier breakers who, despite what they felt, they went ahead and did it anyway. The key characteristic of a barrier breaker was that they had an awareness of themselves and their position. They were not afraid to state their attitudes, biases, and standpoint. They were happy being uncomfortable, and they were happy to be corrected if they got things wrong. There are many other parts of our lives where we are happy to give things a go and be corrected if we get it wrong. Working in Aboriginal health should be no different. Shifting the lens as a process can be achieved through reflexivity. The crucial characteristic of reflexivity is that it is a back and forth process. It differs to reflection, which is generally one way. Someone who is reflecting may say, "I noticed that." Reflexivity as a process goes beyond this and asks us to think, "I noticed that, and how am I going to change my behaviour based on what I noticed?" In 2014, I published a paper from my PhD which describes my journey using reflexivity as a non-Indigenous person identifying as white, undertaking research in Aboriginal health. In that paper, I highlight the challenges I experienced, the learnings that came from that, and the new levels of understanding I was able to reach. I kept a reflexive journal throughout my PhD candidature from 2008 to 2011, and through this I was able to document the uncertainty and the angst that I experienced. This included discomfort referring to myself as white, uncertainty around how Aboriginal people would react to me as a white researcher exploring Aboriginal health topics. I also feared reactions from non-Indigenous people who may have felt threatened by my explorations into their practice. I felt uncomfortable being in the minority because I was spending a lot of time with Aboriginal peoples. It was only over time and through having experienced being in the minority myself that I was able to see that this was a daily occurrence for Aboriginal peoples. This realisation and the learnings I had, which I have talked about in this paper, enabled me to realise that my fear about working in Aboriginal health was less about the Aboriginal peoples I was working with and more about myself, my identity, and my role in this space. Through grappling with courageous questions, such as why am I feeling uncomfortable? How do I see others? What are my beliefs about Aboriginal peoples and non-Indigenous peoples? I was able to shift the lens back onto myself and move past these debilitating feelings. Non-Indigenous leaders must ask themselves these courageous questions. They must shift the lens back onto themselves through a process of reflexivity. In doing so, they take responsibility for their own actions and have the ability to truly work alongside Aboriginal and Torres Strait Islander peoples. Moving on to Aboriginal knowledges and perspectives. Once we have shifted the lens and we have a true sense of our responsibility as non-Indigenous people to continually shift the lens back onto ourselves, what next? It's one thing to recognise the role of ourselves and our own position. It is another to be able to truly take on another's perspective. At this point in the presentation, I would like to segue into the concept of standpoint. Having recognised the role of reflexivity in the first part of this presentation, one of those roles was that reflexivity enables us to identify what we value. What we value changes how we see things and it changes our perspective, and this is called a standpoint. This is illustrated by the simple visual example. This image shows us that how we perceive something is based on the specific situation that we are in. It also highlights that what we see is different based on the angle that we see it from. The idea that we see things differently based on our own life experience and where we come from may not be new to everyone. However, the fundamental and often invisible impact that this has on our work may well be. To see others' perspectives, we must first appreciate that ingrained within each and every one of us is a way of seeing the world that affects what we do every day. This is our standpoint. My standpoint, which includes, for example, I identify as a woman, I am white and non-Indigenous, I am a mother, I was trained as a dietitian primarily in the biomedical model, I see the importance of social determinants on health and on people's lives, and I seek to make a difference to people's lives no matter how small that may be. Recognising that I have this standpoint allows me to see that others have different standpoints, and consequently, they will see the world differently to me. I am not right. I do not hold ultimate truth. I only hold my truth that speaks from my standpoint. As such, I can and I must appreciate Aboriginal knowledges and perspectives. Why does this matter? Well, from a fundamental Indigenous rights perspective, Aboriginal and Torres Strait Islander and other First Nations people have a right for their knowledges and ways of seeing the world to be acknowledged, heard, and included. Unfortunately, in the Western world, this is rarely the case to any great extent because of the privileging of non-Indigenous ways of knowing. For example, in the health field, there are multiple and varied definitions of health. Despite this, the biomedical model, which is a Western way of understanding health, illness, and the body as a set of parts, is often the model on which much of health training and health systems are based. It is the privileged idea underpinning research and practice. Aboriginal understandings of health are multiple and deep, and they add depth to how we see health and medicine. For example, The Dance of Life, a series of paintings from Professor Helen Milroy, a Pauku woman, depict a multi-dimensional model of health and well-being from an Aboriginal perspective, including the physical, psychological, social, spiritual, and cultural dimensions. Therefore, for non-Indigenous peoples to truly lead alongside Aboriginal people, it must be from a point of deeply knowing their own standpoint. As a non-Indigenous person, I cannot truly value Indigenous perspectives and knowledges if I don't appreciate what informs my own perspectives and knowledges. Without a standpoint, I cannot lead with Aboriginal people because I will always be leading from a position that assumes my knowledges and my position is superior. Therefore, I invite you to consider these courageous questions about your standpoint and the way that you see the world. I invite you to consider taking on board and gain a greater understanding of Aboriginal knowledges. Moving on now to a discussion of strength. A discussion of strength is vital in consideration of transformation of non-Indigenous leadership in Aboriginal health. strength is multifaceted in this context. First, as you will appreciate from the discussion tonight, asking courageous questions takes strength. Acting on those questions to ensure that you take action and move beyond a word for reconciliation takes further strength. Second, strength is a vital part of the approach to working in Aboriginal and Torres Strait Islander health. Specifically, we must use a strengths-based approach. As the oldest continuous living civilisations in the world, Aboriginal and Torres Strait Islander peoples have strength, tenacity and resilience. Prior to colonisation, Aboriginal and Torres Strait Islander peoples lived an ecological lifestyle with sophisticated agricultural and aquacultural practices. Despite this, we rarely hear the stories about strengths in Aboriginal and Torres Strait Islander communities. We are surrounded by a deficit discourse. We all know that there is a gap in life expectancy between Aboriginal and non-Indigenous peoples in Australia, and that Aboriginal peoples experience certain health conditions like diabetes and kidney disease at much higher rates. We are bombarded with other stories, for example, lower completions of Year 12 and increased incarceration rates. These stories pervade the media and they create a picture of Aboriginal and Torres Strait Islander peoples that is one of deficit or negativity. Deficit discourse is problematic because it overlooks the diversity, capability and strength of Aboriginal and Torres Strait Islander peoples, and it creates a perception of negativity. Our research into the way in which Aboriginal nutrition issues are portrayed in the peer-reviewed literature found that Aboriginal peoples were regularly portrayed as having poor diets without any discussion about the historical and structural factors that contribute to that. I'm here tonight to say that non-Indigenous leadership in Aboriginal and Torres Strait Islander health must challenge this narrative. It must create a discourse which always comes from a position of strength. Strengths-based approaches move away from the traditional problem-based or negative paradigm that is created by deficit discourse. They focus on what is possible rather than on what is missing. So how do you use a strengths-based approach practically in your day-to-day work and life? First, when writing or speaking about an issue related to Aboriginal and Torres Strait Islander health or peoples generally, it's important to state a positive. Next, you need to explain the structural factors affecting whatever issue you are talking about. For example, determinants that influence the issue, such as access to healthy food. Third, describe the issue. I have included an example on the slide from a paper written by myself and colleagues where the pink highlighted the strengths, the blue section described the structural factors affecting the issue, and the brown section describes the issue. So in the spirit of the topic of this lecture, I invite you to ask courageous questions about your use of strength and a strengths-based approach in your everyday language and writings about Aboriginal peoples. What you write matters. What you say matters. Asking yourself these questions and following a strengths-based approach will make a difference. Moving on now to the elephant in the room. I hope that what I have said so far tonight has been relatively accessible for most people. I've talked about some concepts that some of you may have heard of before, and some which may be new to others. Specifically, I have highlighted 3 approaches that need to be part of non-Indigenous leadership to 1, engage effectively and meaningfully in Aboriginal and Torres Strait Islander health. And 2, demonstrate leadership that seeks to work with Aboriginal peoples and Aboriginal leaders rather than above them. I have posed some courageous questions to help you do this. I'm now going to move on to some concepts which cannot be ignored if non-Indigenous leaders are to truly transform leadership in Aboriginal health. These are generally the elephants in the room. They are always there, whether we like it or not. However, addressing these elephants requires non-Indigenous leaders to be vulnerable, and this is uncomfortable. So how do we do this? In her book, Daring Greatly, Brené Brown defines vulnerability as uncertainty, risk, and emotional exposure. We live in a culture where being vulnerable is seen as a weakness. However, non-Indigenous leadership in Aboriginal health is, by its very nature, something that requires us to be vulnerable. Vulnerability is not about oversharing and telling the world our deepest secrets. Rather, it is about mutuality, and it requires boundaries and trust. This is the crux of the issue. Aboriginal people experience vulnerability every day because of the elephants in the room. Non-Indigenous leaders must therefore also be comfortable with experiencing vulnerability to come from a true place of connection and build trust. In Aboriginal and Torres Strait Islander health, non-Indigenous leaders must engage with vulnerability in relation to these 5 issues: power, colonisation, white privilege, white fragility, and racism. It is not my intention in this talk to delve deeply into all of these issues. I simply don't have the time. What I will do is briefly define each and say why it is important. Power and colonisation. Power takes many forms. However, in this context, power cannot be disentangled from history. Colonisation was and is a form of power over Aboriginal and Torres Strait Islander peoples through removal from traditional lands, rationing and poisoning of food, removal of children, and disruption of a traditional ecological lifestyle. Colonisation and power over Aboriginal peoples continues today, for example, through systemic racism, privileging of non-Indigenous knowledges, and denial of history. Because of past and ongoing colonisation, regardless of by whom or what this is perpetuated, there is a power differential between Aboriginal and non-Indigenous peoples in Australia. For true engagement, this must be reset. My research shows that naming and recognising colonisation in your practice and being aware of how you may perpetuate it reduces this power differential. Other strategies to reduce the power differential include relinquishing control, which is working alongside Aboriginal people rather than leading the process; flexibility, which is fitting your approach to a situation rather than assuming a situation will meet your needs; humility, which is acknowledging that you have a lot to learn; commitment, which involves following through with what you say and offer; and persistence, which is putting in the work to build the relationship rather than expecting others to come to you or trust you straight away. White fragility and white privilege. To clarify, when I use the term white, I'm referring to all peoples who come from a background that was not colonised, and therefore I am talking about all peoples except First Peoples. These peoples are often also referred to as the dominant culture. Using the term white with this definition can be misleading because it does not just refer to skin colour. White privilege is the term that describes the invisible privilege given to members of the dominant culture and to all of those who benefit from colonialism. Peggy McIntosh wrote a famous essay in 1989 which makes white privilege tangible and personal for readers. However, it is important to acknowledge that many black writers wrote about white privilege before this point. For example, members of the dominant culture can be relatively certain that they will not be denied housing based on their race. They can walk down the street and not fear abuse. They know that their knowledges and ways of seeing the world will likely be presented in the popular media and education systems. White people see themselves in the ordinary processes of life, and they see everything that they are about reflected back at them. White fragility, coined by American academic Robin DiAngelo, is the inability and often unwillingness of people of the dominant non-colonised culture to put themselves in situations where they may feel racially uncomfortable. Reactions demonstrating white fragility always show defensiveness. There is nothing wrong with white fragility. We are all allowed to be vulnerable. However, non-Indigenous leaders seeking to be true allies in Aboriginal health must be willing to be vulnerable, acknowledge the issue, and then move on anyway regardless. In practicing being courageous, we have to be willing to fail and learn from our failures. Racism. Most people will declare that they are not racist. This usually isn't true, especially when it is followed by the word but. However, in our society today, not being racist is not enough to make a difference. We must also seek to be anti-racist, which is a skill set rather than a set of values that actively combat racism. Having good intentions is not enough. Systemic racism is also often overlooked. This refers not to individual acts of racism, but rather to the ways in which the system disadvantages peoples who are Aboriginal or Torres Strait Islander. While we may not have overtly racist policies like the White Australia policy anymore, our country post-colonisation was founded on them, and therefore they continue to shape the fabric of our society. We see the outcomes of systemic racism every day. For example, the increased numbers of Aboriginal children in prison, the deaths of Aboriginal and Torres Strait Islander peoples in custody and in hospitals when presenting for care. Just when we think we can see the processes of systemic racism, they slip away again as they are largely invisible. Despite this, we must acknowledge systemic racism and we must try to see it. So what do we do with all of this? First, before anything else, we must name the elephants in the room. We need to speak openly about power, colonisation, white privilege, white fragility, and racism. Once we have seen these elephants in the room, it is very difficult to unsee them. Seeing the picture that I have presented here tonight is the first step towards being able to work and lead in a way that does not perpetuate colonisation. Once we name these concepts, we begin to see them all around us. In fact, so often these elephants in the room are so strongly denied that all we have to do to make a difference is actually point them out. Then the facts begin to show themselves. However, and importantly, pointing out these elephants requires us to be vulnerable. We don't know how the others around us will react. In my presentation tonight, in the spirit of Reconciliation Week, I encourage you to be vulnerable and point out the elephants. Being courageous and vulnerable requires practice, but it is something that gets easier with time. In doing so, you also help to normalise discomfort. Discomfort is a part of growth, and normalising discomfort is an important part of creating a culture where we are willing to have hard conversations. This is necessary when transforming non-Indigenous leadership in Aboriginal health. In this evening's lecture, I have invited you to ask courageous questions. In the spirit of National Reconciliation Week, I am inviting you all to take your thoughts and answers to these questions as a way to facilitate moving beyond the word into action. Tonight, I have demonstrated that non-Indigenous leadership in Aboriginal and Torres Strait Islander health, both in the workplace and community and social settings, requires a fundamental shift. The key to this fundamental shift is asking courageous questions and therefore being vulnerable. I have invited non-Indigenous people to use practical strategies, including shifting the lens back onto ourselves, acknowledging Aboriginal knowledges, and using a strengths-based approach. In addition to that, I have invited non-Indigenous people to openly acknowledge and address the elephants in the room, to be vulnerable and courageously name the issues that must be considered for true allyship and non-Indigenous leadership. This includes acknowledging power, colonisation, white privilege, white fragility, and racism. Using these approaches is the only way to work alongside Aboriginal peoples in a way that truly encapsulates reconciliation and allyship. I invite us all to be brave and ask courageous questions. Thank you.
Many thanks, Annabelle, for those powerful insights, an extraordinary discourse through some really challenging concepts. The elephant is such a great analogy, this notion of an elephant in a room. Come and take a seat, and we're going to continue the conversation in comfort. And it is interesting, isn't it, the notion of the ongoing impact of colonisation, of white privilege, of systemic racism, and how we shift that perspective. And arguably, it's not just health where we need to be casting the lens, although that's the point at which we have tackled the conversation, the aspect we've looked at this evening. So I'm going to ask the audience to consider their questions and to continue the conversation with us. So anyone who has a question, if you'd like to make your way to one of the two microphones in the centre of the room. And likewise, for people who are online, please don't hesitate to jump online and pop your questions in on the platform through which you're watching this video. And we will do our very best to get to all the questions tonight. If we can't get to them all, well, we'll find out a way of trying to get back to you. It might be in a box on the video afterwards, where we might be able to continue the Q&A session. Or if you've got something which is sort of more direct, where you're looking for a personal answer, we'll see if we can be in touch by email if you leave your details. So we'll do our best to get to all the questions tonight. So please, if you're in the room and you'd like to make your way to the mics, please do. Other than that, I'm going to get the question started. And one of the things that occurred to me was, okay, Annabelle, so you're a dietitian. This is a really big field, isn't it, for a dietitian to be getting into. How did you find your way into asking these questions? What was the key that unlocked this door for you?
Thanks, Karen. So I guess what started this journey for me was actually practicing as a dietitian. So when I was a new graduate, I found myself working in a role based in Port Augusta, doing outreach to remote Indigenous communities. I felt very ill-equipped and unprepared for the challenges that I was faced with in that year. And I decided that I wanted to do research through a PhD to really unpack not only what my own experiences were, but also of other non-Indigenous health professionals working in the area.
And how I mean, at the very beginning part of that journey, that must have been somewhat daunting, which I think probably speaks to some of the concepts that you've been going through tonight, this fragility and the vulnerability. But how did you get a sense that you were going in the right direction, you were making progress, that this was an appropriate thing to do? Because it occurs to me that a lot of the challenge that people face is being very well-meaning, having great intentions, but not understanding whether their intentions are actually achieving the desired outcome, whether they are being, truly inclusive, understanding, respectful, and empathetic. These are all qualities that, really should be born out of a process such as you've described tonight. But people aren't always certain that they're going to get those results, and if they feel that they're failing, then they shut down. So how did you navigate that process?
Yeah, I mean, you refer to being daunted. It was and continues to be an exceptionally daunting process. I think for me, using reflexivity is a crucial tool because it allows me to work through those feelings of angst and uncertainty, which I talked about. And it's really only in hindsight that you can appreciate that. Probably the other key, the key thing which guided my work is working in partnership with Aboriginal peoples. So for my PhD, that was Aboriginal health workers, other Aboriginal health professionals, as well as people in the community who I sat with and spent time with, and I heard their stories. And when the time came, I had trust in a relationship, I spoke to them about what I wanted to do. I had mentors. I still have mentors. That was and is fundamental to what I do.
And another thing that occurs is that as a university, we've embarked upon a process of a reconciliation action plan. We are, as a community of minded people, wanting to ensure that we can and do better, both in a practical sense but also philosophically. Number one, I mean, how are you seeing Flinders progress through that? Given the concepts that you've been talking about tonight, is it a journey that you think is making the ground that it needs to? And I know that's a tough question to ask an observer, but there are a lot of well-meaning people. We're about halfway through our first wrap. How's your sense of how it's progressing at the moment?
Yeah, great question. Look, I think a RAP is a fundamental part of an organisation. It is important to recognise, though, that it is only one part and that a RAP must be implemented every day through the actions of the people who work at the organisation. And I think that it's just really that is really crucial. Yeah.
We have a question here about the importance of the university's footprint of research, education and community commitments along the Central Australian corridor. So it's that does raise a notion too about how do we ensure that our engagement is culturally appropriate at the micro level almost. We may think about our engagement at a political level. You've got political leaders who want to espouse leadership and espouse fairness and espouse equity, but their policies don't always back that up, let's be honest. Their rhetoric doesn't always back that up. Now as a university, we're working not at that big level, but in individual spaces. Do we need to change what we do for each space that we go in, or is there a way that we can ensure we're always doing well no matter where we find ourselves?
Great question. I think that good practice in Aboriginal health, working with communities and in research, is based on principles and approaches. So the approaches that I have talked about tonight, those are transferable across different communities. It is important, obviously, to be aware that different communities have specific different cultural processes, and those are the types of learnings that people can get through local cultural awareness training. It's important that people know about the peoples that they are working with and their history. So I've talked generally tonight about history and colonisation. What is preferable is if people have an understanding of those issues in their specific geographical area. But generally, the approaches are transferable.
We have a question from the audience. Peter, would you like to pop your question to Annabelle?
Yeah, thank you very much, Annabelle, for a very thought-provoking and indeed very brave lecture. I'd like to draw you out a bit on this concept of trust. And you mentioned it in the context of vulnerability, but you also mentioned it very on in your presentation about this notion that there is a mutual distrust between both Indigenous peoples and non-Indigenous. And I think I understand from your presentation where the origins of the distrust between Indigenous and non-Indigenous people come from, but the other way around, I'm not so sure I understand where the distrust of Indigenous people would come from non-Indigenous. I'm wondering if you could maybe perhaps just provide some thoughts around that.
Can I just clarify, you're talking about, can you just clarify again the direction of the trust, please, Peter?
Well, I think given the history of colonisation, all the things that you spoke about, there's I think a pretty obvious reason for distrust of Indigenous people, of non-Indigenous. The other way around, I'm not sure I understand the origins of that, and I'm just wondering if you can comment on that.
Yeah, sure. No, thank you for your question. Personally, I think that comes back to racism and white privilege and white fragility, that people fear what they don't understand, and that there is a lack of knowledge, in the general population about Aboriginal and Torres Strait Islander peoples, and that creates distrust, and that when you combine that with the other issues like racism and the examples of racism that we see every day, that is what contributes to that.
Thank you. That question was from Professor Peter Eastwood. He's the director of our Flinders Health and Medical Research Institute. Now, I see we've got a couple of other people making their way to the microphones. Oh, there's 2 microphones, so you can certainly make your way there. I'll get you to introduce yourself as you ask your question, please. Thank you.
Hi, my name is Rebecca Court. I am a senior advisor in developmental trauma, but equally work around the country with generally rural and remote Aboriginal communities. And I had a question around a broader topic that you mentioned around, I guess it centres around the building of trust. So I've just written down in my notes because you had a lot of food for thought tonight. Based on what we know about the epigenetic transmission of distrust due to the experiences of colonisation, we need to demonstrate trustworthiness in terms of coming, I think, as an agent from an institution in general or a government organisation. How do we do this within systems that continue the process of invisible colonisation? You mentioned Brene Brown in terms of vulnerability. My favourite Brene Brown work is on the anatomy of trust, where she talks about, I think she doesn't mention it in so many words, but the deconstruction of the power relationship. Yeah. And for me, I've been holding this question as a professional for a long time in terms of how do we explore the anatomy of trust in terms of the helper-helpee relationship, which is often implicit in these, I think in health, which is the industry you're talking from. I talk from a broader industry, but health often intersects with where I come from. How do we explore what that looks like from within institutions that have historical implications with betrayal of trust?
Yep. Thank you for your question. That is a question which I grapple with all the time. And unfortunately, I don't think I have a clear answer. my opinion and approach is towards that is that process of invisible colonisation remains so powerful when it stays invisible. If we are able to name it, whether that even be in a small way, I think that helps to reduce the power over that it has. It's by no means a complete remedy, but I think that it's the first step. In doing that, that also is the building block for trust, because trust cannot be developed whilst we still have this unacknowledged power differential and colonisation processes happening.
Thank you. We have another question from the audience.
Hi Annabelle, I'm Emma George, Senior Lecturer in Occupational Therapy at the University of Adelaide, and I finished my PhD here at Flinders in Public Health last year. Annabelle knows I drew on her work, especially the 2014 article on reflexivity. So my question is about shifting the lens and the elephants in the room. So as we're becoming more mindful of standpoint and power, colonisation, and in particular white fragility or even white supremacy, have you found that those questions you asked and wrote about in the 2014 paper about identifying challenges and learnings and new insights, can we use that to then also wrestle with white fragility and the reactions that we get when we start to challenge leadership in this space?
Thanks, Emma. Definitely. I think that reflexivity as a process and those questions that I asked around the discomfort that I was experiencing are extremely transferable. I think that that's precisely what we need to do in relation to any of these issues. I guess the issues that I spoke about in that paper were, much earlier on in my journey, and they were, exceptionally relevant for me at the time, and now I see that I ask the same questions, but in relation to these new concepts. So yeah, thank you.
Any other questions from the room? Yes, we have a couple of others.
Hi Annabelle, thank you for your presentation. That was some really good practical examples. I'm Brooke. I work with the Flinders Point of Care unit here at Flinders, and I've been working with rural and remote communities in the Northern Territory for over a decade now. But my background, I grew up in Port Augusta, which you've already mentioned tonight. And I guess my question comes from, I guess I was privileged enough to be in a school in Port Augusta where we're almost exposed, we're almost on a daily basis, we were exposed to Aboriginal culture in terms of language, stories, food, artwork, all of those things, which was fantastic, and I wish it happened more these days. I don't know to what extent that it does, but I guess in that location I was also exposed to, outside of school, sort of overt racism, I suppose, and that's still something that I battle with now, and I wondered if you had any experience or sort of examples where you've had to deal with sort of overtly racist comments in your work, and how you've done that and what the reactions have been, because I guess that's part of being courageous enough to stand up, and one thing that I've personally battled with.
Yeah. No, thanks, Brooke. Certainly when I was undertaking interviews with health professionals for my PhD, I did hear overtly racist comments. That was hard because I was much earlier on in my career, and it often took me a minute to kind of recognise that what that person was saying in that context. In more I guess, recent examples, I think that the racism that I see is much less obvious, and it's systemic racism. So what I talked about, that we see the effects of that every day, but actually seeing the processes is really, really hard. And learning how to, name that in a way that highlights that, no racism is acceptable is difficult, particularly if that's in a workplace setting. So again, I don't have the answer. I think I would say that being aware of it and being ready for it is probably the best type of preparation, and knowing that there will be times when you do have to point that out, and that is hard, but that's okay. And then I always have wonderful colleagues to come back to debrief with.
And let's be honest, if it was easy, we'd all do it.
That's right.
That's part of the problem. We have another question from the floor, and then I have an online question we'll go to, but so that our interlocutor on the floor doesn't have to stand for much longer, I'll get your question in first.
Thank you, Annabelle. I'm Catherine Jackson from College of Nursing and Health Sciences. I really want to thank you for beautifully articulating thoughts that have been going zip, zip, zip in my brain and haven't connected. And I particularly appreciate the connection you've made between white fragility, white supremacy to a certain extent, and racism. So my question is probably unanswerable, but I'll ask it anyway. I have peers, not colleagues, but peers who I recognise overtly, after what you said, shall we say, symptoms of white fragility that link directly to what I would call entrenched racism. How can that cycle be broken? Do you have practical tips? I argue, obviously ineffectively, with these people. They are peers, so I can speak fairly openly with them. How do you break down that seemingly really strong link?
Yep. Thank you for your question. I think it depends on the type of person and the personality. I think in a social setting, it's certainly it's somewhat different. Often when if I don't know what to say immediately, one reaction can be to actually explore it further with the person. So, it's really interesting that you think that. Can you tell me more about it? And often when you ask that question, people are unable to articulate further information. They're unable to provide justification for their views, and they will quickly back down. Obviously, that's not always the case, and I think that sometimes, again, in a social setting, you may just have to be as blatant as them and say, look, that's racist, like calling it out. And I think part of the looking at it through the lens of vulnerability is about, pitching it in that you're not going in there to have a battle or a fight. You're just simply saying, look, this is my perspective, and you may not change their views, but at least you've aired your opinion, and it may give them food for thought.
Thank you. I'll keep battling politely.
It's ongoing. It's not one conversation.
No.
It's multiple and many.
Yes. Thanks,
Yeah.
Annabelle.
We have a question from Jonica. Hi, Annabelle. Thanks. Fantastic presentation. I concur. From an academic standpoint, identifying best practice approaches towards better Aboriginal health outcomes is an important step. But ultimately, outcomes will only be achieved when applied by public health institutions? This is a broad question, but do you have a comment on how to best promote uptake of these approaches in public health institutions?
Yeah, thank you. Fantastic question. Again, that's a question that I battle with all the time. You know, it's one thing to do research, but it's another to actually question whether it makes a difference to practice. I guess the point that I've come to with that is to not focus on the wider scale system change, which would be fantastic, don't get me wrong, but it's looking at the success stories on an individual level. So, you know, I know from just from feedback that the approaches that I have researched and published are used. They're not used by everyone, but they are used. And I think that it is a slow process of spreading a message about ways in which we know are the effective ways to work. I would also say that people in practice should never underestimate the power of their own practice, and that they can make a difference, and that making a difference even to one person's life is making a difference. And that is also a form of role modelling. So in practice or in research or in social settings, where we use these approaches, we forget that we are also role modelling them to others. And that is another way, I think, to spread them through organisations.
A wonderful note on which to conclude tonight's discussion. It's food for thought about how we take this forward, going forward, and how we all have even a small role. But even a small role can make a substantial difference. It's a cumulative effect. I'd like everyone to please thank Annabelle Wilson for her contribution tonight. A wonderful discourse. Thank you. And I'd also like to thank our audience, and both here in person and online, for their engagement in tonight's wonderful discourse. And this is one that I really would encourage everyone. It was one of those presentations that can be difficult to take the whole lot in one sweep. Go back, have another go at the entree, have another go at the main course, have another go at the dessert. Give yourself time to digest it. This is one that will be worth revisiting. I am sure of that, and I think in doing so we will all get more benefit out of it the more we allow ourselves the opportunity to really process this. So thank you very much everyone who helped contribute to tonight's wonderful event. I'd also like to again thank Bank SA for their support for this Brave Lecture series, and I would like to just, as a little plug here, point to the next event that's coming up. Always good to know that we've got wonderful food for the mind coming very shortly. Our next Brave event is on the 21st of July, and its title is the Aged Care Royal Commission. What now? Gee, I don't think there'll be much talk about it, that one, will there? That one's being presented by Professor Julie Ratcliffe with a panel discussion with Professors Sue Gordon and Jen Tiemann. So pop 21st July in your diaries now. I think that'll be a very popular one. So I look forward to hopefully seeing you all then, and for all of our online guests to join us again as well. So on that note, thank you all, everyone, and good evening.